And welcome back to Good Morning Maryland at 9 o'clock. Winter is here, and think about it. You'll winterize your house, you'll winterize your car, you'll even winterize your pet's housing. But what about yourself? If you're an older adult, those simple winter ailments like colds or sniffles, they can sometimes escalate into much larger problems. In this morning to talk about that and some things you need to know, Dr. Alicia Arbaje joins us to discuss some tips. And this is an issue with older adults because many times they don't want to be a burden on their family or their friends, so they'll just let some of these things just kind of go by the wayside because they don't want to be a bother.
Right. They're always worried about other people and making sure that they're well. But it's really important as we come into a new season to really take stock and think about what we can do to try to improve our own health. So it's important for the older adults to do the same.
And educating those older adults, getting them ready, simply put, what can we do?
Right. There's many different things. But as you said earlier, really wintertime is a time when they're more susceptible to other illnesses. So one of the first things that they can think about doing is making sure that they get vaccinated. We often think about the flu vaccine because that's very important, and we still should. But there are other vaccines as well, the pneumonia vaccine being one of the most important to think about, but also tetanus and shingles vaccines as well.
Now, one thing a lot of these older adults may be concerned about is what you refer to maybe as medical mayhem.
Yes.
Getting a little overload, just keeping things simple seems to be very important.
Keeping it very simple, especially with medications. This is a great time of year to meet with your doctor or healthcare provider. Make sure you don't need to be on all the different medicines that you are, or if you do, to see if the doses change, because as you get older, those needs may change. And also making sure that they have enough medications to last them through the winter.
Now, it's so important that our older adults stay active and be a part of something, but as it gets cold, a lot of them are going to kind of hole up, stay inside. Do they need an exercise regimen when they're indoors?
Absolutely right, because we eat more during the holiday season. It's cold, it's dark, we don't get outside as much. So it's really important to have a plan for keeping that exercise routine going, whether it be yoga, tai chi, something that can keep them active throughout the winter season.
And the degeneration of bones, osteoporosis, this is also something to think about, especially as it gets colder because the bones ache.
Right, bones ache, and people are walking outside on slippery surfaces and are more at risk for falling. So the best way they can prevent falls is to make sure that they're having calcium and vitamin D as regular as they can be, that their levels are normal, to help prevent and strengthen those bones to prevent falls.
Now, simply put, one of the tips you sent to us was check your head.
Right.
Now, for a guy who's 35 years old,
that can mean a lot.
You're gone. It's over. But for our older adults, we need to make sure they're in sound mind to take care of themselves, or if they're not, get them the help.
Right, exactly. So there's a few things when I say check your head. So one is to make sure they don't stay isolated. Call their friends. Make sure that they're not being susceptible to the holiday blues. A lot of stress during this time. But also making sure that the things on their heads are actually there. Glasses, dentures, hearing aids, making sure they're all in tip-top shape to help them throughout the winter season. Dr. Alicia Arbaje with Johns Hopkins, thank you so much. Now we'll have a complete list of the 10 tips you need to know. We just hit 5 here. Those tips will be on our website, abc2news.com. Megan, over to you. All right.